Today we're exploring potential treatment options for hip issues in young adults. Our facilitator is Gary Desjardins. He's known as a deep strategic thinker and problem solver. He helps executives and companies achieve breakthrough results. Welcome, Gary.
Thank you, Gene. Good morning, good afternoon, good evening to our listeners.
We are here on theme number 3, our final theme, a deeper dive on certain therapies. What are we going to talk about today?
Yeah, we've really gotten just a wealth of ideas and potential therapies to help our 17-year-old. And there's certain ones that we wanted to cover in a little bit more detail. The parents in particular wanted to learn a little bit more of those in detail. So we're going to do that today.
Great. Now let's talk about the panel one last time.
Yeah, we can't thank the panel enough. The parents, we had a debrief yesterday, and they were just glowing in terms of the excellent, practical, scientifically based ideas and therapies that have brought forward. And the diversity was really helpful, I think, in casting a nice range of applicable options from, oils and nutrition all the way up to, call it really minimally invasive types of approaches such as cortisone shots and that kind of thing. So job well done.
Great. So in your executive summary, I know what we're going to talk about is the panel did an excellent job of vetting these non-invasive therapies.
Yeah, and the confidence in terms of the steps forward are really, I think, high relative to what the parents have to work with here. We got into a more focused conversation on a number of shortlisted therapies, and those therapies are so practical and actionable, and the science behind them are sound, and there are even locations which have been identified. In the process, not surprisingly from this board, they also brought a few new ideas. So we've actually added to this great list with a couple more ideas. We'll cover those in a moment. And as I mentioned, at the heart of all this really has been a concern, or at least a focus on providing evidence-based options, and the panel continues to do that.
That's great. So our next slide here, tell us about these 5 shortlisted therapies.
And these are the 5 that the parents wanted to learn a little bit more about, and we could spend, probably 5-10 minutes on each one of these. So I'll just cover this a little bit high level because we really got substantially important information, further understanding of these potential options, the science behind them. So if you recall the labral tear that hadn't really been formally treated yet, we wanted to learn more about how to manage that pain and possible surgical options down the road. We accomplished that. The chiropractic care, particularly in terms of what kind of credentials and qualifications, how to go about identifying someone who can specialize in the areas needed, was really helpful. Acupuncture, a lot of great literature. I think acupuncture is kind of one of those fringe, therapies that some people really benefit from, others maybe not so much. And so there's maybe a little bit more of a mystery around it, but there was some good science that was brought forward to help the parents make a good decision. The cortisone injections, again, great ideas there. This is where I think sometimes, injection sometimes seems to be very, not very invasive, not high risk, but the panel actually brought up some yellow flags, some yellow lights with that in terms of just being very cautious about taking that approach. And so the parents really appreciate that balanced perspective. And then, of course, the last one, compression and the overall recovery process of rest, ice, compression, and elevation. They wanted to learn a little bit more about that, particularly around compression, because there's other therapies and other devices that can help create a sleeve that can create the right compression over a period of time. Those new technologies, we wanted to get into that, and we did. So great job by the panel to dive into these in more detail and really equip the parents and our patient with, I think, really sound options going forward.
Now, you also did discuss additional therapies. Walk us through these.
Yeah, not surprising, as I mentioned before. The list continues to grow. Plasma regeneration therapy, PRP, is one that has been out there quite a while. Mesenchymal cell therapy is one that's a little bit more near term, but, again, a potential to look into. Electrostimulation has also been, it's a little bit newer, but it has been around a little bit. There's some good science on that. And then therapeutic ultrasound is another one. Are options that are non-invasive, fairly good track records, and so these were added to the list.
And most of these came from Lawrence?
Yes, he was busy not only in helping us further learn about the previous 5, but also coming to the table with a few extra ones that he found through his experience.
I really love what you did in this next slide here, Gary. The 3 recommendations. Tell us what we're looking at.
Yeah, so one of the last questions we asked as part of this theme was if this was your daughter, what would be the 3 things that you would pursue?
That's a great question, isn't it?
Yeah, it really changes, I think, the perspective, and I think that our client mentioned it as well. It's often, a little different filter. And in general, everyone is recommending, RICE. So rest, ice, compression, elevation, in general, some kind of component of that. But then really what you're seeing here is a combination approach, that many of these are not mutually exclusive. You can do a combination of different options. And so it's this combination therapy, which the parents have already started, that they are actually starting to see. And the daughter's actually feeling much better this year during her soccer season than in years past. So these are great combination types of therapies that the parents are really appreciating. And we wouldn't have been able to, I think, really plot out and cast the net as wide as we did if we didn't have this diversity of the group.
I also love the way you presented this. So it's, again, sort of emphasizing that it's not just one thing that might be the cure. It may be this combination, and the sum may be greater than the parts in some cases. So it's not just finding out, what should I use? It's saying, hey, let's combine these things together and really come up with something that's magical, right?
That's right. And that's exactly, you almost took the words right out of the mouth of our parents, which is that the approach they had been taking was kind of one thing at a time.
It's kind of normal, right? It's like, well, we tried that and that didn't work. And then we tried that and that didn't work. Or we tried to work a little bit, but not a lot. So maybe if you have a little, and a little, all in 3 components, all of a sudden you've got something that has a better impact. And it sounds like it's been really wonderful for the quality of life for the patient in this case, right?
It sure has. Big win.
Okay, let's talk about this great map that was put together, this priority map. Can you walk us through this?
Yeah, so if you look at the different therapies along here, the 7 or so, what I would say high potential, and you can see a number of those we dove into here in more detail, acupuncture, chiropractic, the compression. These were then rated axis of the likelihood that they would have an impact, and then the bottom being the potential for pain reduction. And so you can see how this map really helps for the parents to be able to prioritize all these.
Mm-hmm.
And so,
kind of surprised chiropractor didn't end up in that upper quadrant. Were you?
These are impressions, right? That we have, and every patient is a little different, and so that's not to say that it's not high potential relative to this patient, but as it relates to prioritizing, it's still on the list, so to speak. And it has an individualized characteristic, which should be explored, will be explored. And I think that's really the nature of chiropractic care, is that sometimes it's based on the individual.
One thing I loved about this panel, Gary, is we've never done anything like this before. So before we let you go, do you mind telling us about the top 3 experts? And then also, could you go over the panel objectives?
Sure will. As we went through this panel, although we have 3 identified here, what was, I think, really pointed out by our customer was just the way that the panel gelled over time, and they fed off each other. So they kept building and building and building and providing, sometimes, balanced feedback in terms of this might work, but then it might not work. So really, these 3 certainly carried a large percentage of the load, so to speak, but the whole panel was really instrumental in conversing together to make the parents feel very informed.
And remind us again, what was the panel objective?
Yeah, and in our debrief yesterday, the 3 objectives. One is to identify a breadth of potential non-invasive treatment options to reduce pain. The second was to create a depth of knowledge supported by science on these different techniques. And then finally, to be able to identify some leading practitioners or thought leaders that parents could go pursue. And some of those actually do come from the science itself. As you look at the authors and the institutions that support that research, they can also use that as a input or as a resource. And so really, we hit all 3 of these objectives very cleanly. And so we're at this great position to be able to close the panel, as sad as it is for, I think, for myself and for the parents, because it's been so rich, and hopefully the participants, the panelists, enjoyed it as well. But job well done, all other objectives were met. And the most important part is that the patient is improving and is feeling much better.
And gosh, it's amazing the parents had the forethought to come up with this idea of maybe using this platform and AI to put together great research from a diverse set of thought leaders on a panel to come up with really stellar results. And this is really a feel-good piece of research, isn't it?
Well, sure is, because as you mentioned, or as this would be obvious, is that as we present this, then there's other patients, or excuse me, other parents or other people who have this hip retroversion, and this now provides a resource, a wealth of different options that they can pursue with evidence to support that. But as importantly, then it opens the door to others who have different ailments that may benefit from a similar type of panel to give them different options that they may not be aware of, but also the breadth of knowledge to be able to have those conversations with their physicians, primary care physicians, and then also possibly some indications on who they should approach, who are leading those different types of therapies or institutions that seem to specialize in those. So hopefully this will open the door for more folks like our 17-year-old and their parents who want to choose a different path than something that's more invasive, and give them some options to feel very much more in control of the steps forward to recovery and a healthy lifestyle.
Well, great job facilitating this. And again, thank you for walking us through this great presentation. Gary Desjardins, known as a deep strategic thinker and problem solver, he helps executives and companies achieve breakthrough results, as we did with this panel. So I look forward to the next time we talk, Gary.
Thank you, Gene. You have a good rest of the week.